Bismillahirrahmanirrahim. Uh, this is the verse from Quran that translates as, "And your Lord has said, pray unto me and I will hear your prayers." Today the topic of my presentation is planning cycle, and I am presenting it under the supervision of my professor, Dr. Saira Afzal. Learning outlines. Learning outlines of the presentation are introduction of health system planning, introduction of planning cycle, components of planning cycle, factors affecting planning cycle, and recent advances. Learning objectives. At the end of this presentation, participants will be able to describe about the planning cycle in health system and factors affecting its implementations. What is planning? Planning is a process to assist in evaluating a situation, developing incident objectives, selecting a strategy, deciding which resources should be used to achieve the objective in the safest, most efficient and cost-effective manner. Planning is deciding in advance what to do, how to do, and who is to do it. It bridges the gap between where we are to where we want to go. It makes possible things to occur which would not occur otherwise. Introduction of health planning. It is the identification and elaboration within existing resources of means and methods for providing in the future effective healthcare relevant to identify health needs for a defined population. Aim of health planning is to maintain and improve health status of a given community. Rationale of health planning. Planning of delivery of effective health services to the population within resources provided. Translation of new policy statement into operational plan. Replanning on the basis of an already existing plan for the purpose of reviewing existing health problems and needs and rendering services more effective and efficient. A planning cycle. Planning is a dynamic process. It involves 3 steps. Planning, implementation, and evaluation. If no favorable outcome, then change the plan, implement, and reevaluate it. This picture shows the steps that are involved in planning cycle. First is plan the planning. Second, review of policy guidelines. Third, situational analysis. Fourth is review of resource available. Fifth is the development of interventions. Sixth is setting plan objectives and targets. Seven shows that we need to determine resource requirements. Eighth is objective adjusting MNO management on organization systems, preparing the budget. 10th is developing the plan of operation. 11th is planning for monitoring and evaluation. That all leads to plan implementation, and the cycle continues for new plan. Now explanation of all these points is given. Plan the planning. This stage deals with the prerequisites that have to be in place and issues that have to be resolved before actual planning exercise may start. The objective is to ensure that planning process can be carried out smoothly. It establishes the identity and position of the planning body, that is team. Specific terms of references are what has to be planned, the purpose of planning, defining target group, for what time period, and identify resources available. Timings, tasks and responsibilities. Assign responsibility to each member, like chairman, secretary, core members, community representatives, and from other government departments, NGOs. Review of policy guidelines. It is the process of familiarization government directives and conditions that must be followed in preparation of the health plans. To ensure the health plan is in line with the government national health policy, examples are National Reproductive Health Package that is with 4 priority areas: safe motherhood, infant death, reproductive health problems of adolescents, reproductive health problems of male, detection of breast and cervical cancers, infertility, family planning, and sexually transmitted infections. Situational analysis. The situational analysis is the process of analyzing and interpreting all information available from the various sources on the current situation of the health system as it prevails within the specific geographic area under consideration. Specific purposes of situational analysis. Purposes are to identify health problems and health services that needs arising as a result of these problems, to determine causes and circumstances underlying problems in the health situation as well as with the delivery of health services, to assess availability and adequacy of resource in the light of health service needs, to identify gaps and weakness in the healthcare services in line with health problems and service needs. A source of situational analysis, census, health information system, hospital records, health system review, also called as health system analysis, special surveys in the field, qualitative method for data collection, and vital statistics. Situational analysis as descriptive and analytic. Initial problem diagnosis is one of the most important yet neglected part of the health planning. Problem diagnosis should be based on any plan. However, frequently planning is done largely based on poor information, on assumption, and even based on personal bias, special interest, or preferences. The situational analysis consists of a descriptive and analytic part. The descriptive part describes the situation as it is at present. This helps in assessing the magnitude of the problem, which in turn helps in prioritizing the problem. While the analytic part deals with the factors that determine the existing situation and is used subsequently for developing appropriate interventions. Examples of the descriptive components are contraceptive prevalence rate for all and modern methods, types of contraceptives used by couples, and unmet need for contraceptives. Well, examples of for analytic components of situational analysis are knowledge about contraceptives among men and women, decision making about the use of contraceptives, contraceptive use by location, education, socioeconomic status, etc., and available sources of contraception and their course. Components of situational analysis. Components are that to determine existing problem, prioritize problem, ascertain available resources for addressing existing problems, and identifying weaknesses and strengths of the existing system. Assessing the health system service inputs or programs. The planning team now needs to answer the following question in situational analysis. First is given the identified priority health problems, what health program needs to be offered to the community? What health programs are currently being offered in the community? Are they appropriate for the community's health needs? And what are the major strengths and weaknesses of the system? Before further assessment of the availability and appropriateness of services to needs, a list of the number of facilities should be established by type, by operation authority, or by location. And by type, these are hospital, health center, dispensary, health houses. And by operating authority, these can be government, mission, other NGOs, private organization, or donor, and by location. Assessment of service outputs, assessment of outcome parameters, service outcomes, behavioral and cognitive changes outcomes, and hospital or facility outcomes. Impact assessment, preventive or curative assessment of community participation, assessment of the effects of ecology, geographic factors, social, cultural, and political factors. Review of available sources. That is the fourth step in the planning cycle. This is to assess. These would help in determining the scope of the health plan and selection of the intervention strategies. Manpower. That is used in terms of the number, cadre, gender, and quality of human resources. Material or physical resources. This includes buildings, equipments, transport, drugs, contraceptives, and dealing with availability and functionality of these. sources. Money, to see how financial resources are allocated, such as with respect to salary, non-salary, their release and utilization, whether governments or NGOs are financed. Intangible resources shows information, official documents like and policies, goal, objective, programs, financial reports, approved budgets, etc. Development of interventions is the fifth step in planning cycle. It is the process of identifying, shortlisting, and developing intervention measures from among a variety of potential interventions. The objective is to identify and develop most appropriate interventions for existing health needs. Example is the three delays model that is given by McCarthy and Main in 1992. This picture shows 3D model. Setting plan, objectives, and targets. This is the sixth step. It is the process of defining what one wants to achieve, that is expected results, within a planned period of time in the light of earlier identified health needs. The main purpose is to highlight what planner wish to achieve. Quantify these, enable a focused selection of inputs, and enable activities that will bring about these. An important element of planning is the setting of clear-cut objectives, targets, and goals. Now, what is objective? Objective is a planned endpoint of all activities. It is stated in terms of measured amounts of progress towards goal. Objectives should be SMART. That is, it should be specific, measurable, achievable, relevant, and time limited. What is target? Target, when the objective is split into discrete activity, it becomes target. Like number of sputum smear collected or chest tube placements done, this can be said as targets. Goal, an ultimate desired state towards which the objectives and resources are directed. Goal is not constrained by time, resources, nor are they necessarily attainable. They are formulated at top level and they are generally broad, for example, like health for all. Examples for these are aim is to, for example, to improve reproductive health services in a district XYZ. Objectives can be that maternal mortality shall be reduced from current, that is 340 out of 100,000 to 300 out of 100,000 within 4 years, from 2005 to 2008. By the end of 2007, 80% of women delivering in the village of district will be assisted by trained birth attendants. This is said as a sub-objective. Target setting. Target is like the number of midwives to be trained, number of training sessions to be held, number of tetanus injections to be given, number and frequency of prenatal visits, and percentage of obstetric complications that are seen in main hospital. Determine the resource equipment. It is the systematic process of translating planned activities into resource needs. The purpose is to identify to what extent existing resources cover planned interventions and to what extent additional resources shall be necessary, and what is available. What additional resources are required to carry out planned activities? Are they additionally required, like resources potentially available or not? Adjusting M&O system. This is the 8th step. The management or organization system is the coordinating center for all health service activities. The main purpose of management or organization system is to ensure maximal efficiency and effectiveness of healthcare delivery system. Among several functions of the M&O system, the more important ones address manpower, money, and material issues, and the functioning of the support system in general. For example, in the case of EPI, the planning team needs to review availability of vaccinators and supervisor, adequacy of vaccines, adequacy and functioning of the cold chain equipment, availability and integrity of the transport, as well as petrol, oil, lubricants, and essential spares. Availability of financial resources for field monitoring, and availability of a record system before implementing a plan for improving EPI coverage in the district. Preparing the budget. Preparing the plan budget is the process of translating inputs, targets, and activities into money. The main purpose of budgeting will be to first is to identify overall financial requirements by plan period and individual year. Identify financial requirements by line item and by specific programs, and enable performance budgeting. This picture shows a health budget that shows salaries and allowances, non-salary budget that is drugs and supplies, utilities, TADA, repair, maintenance, and other things. Developing plan of operations. A plan of operation is the written summary of the implementation plan, specifying sequence and timing of and responsibilities for implementation of the main objective, expected results, and activities. The operation plan provides a set of ready guidelines for the day-to-day running and the periodic assessment of the functioning of the health services for the plan implementer. One of the most useful tools in the preparation of a plan of operation is the Gantt chart, and the other is critical path analysis. A Gantt chart is a type of bar chart that illustrates a project schedule. The chart lists the tasks to be performed on vertical axis and time interval on horizontal axis. The essential concept behind critical path analysis is that you cannot start some activities until others are finished. These activities need to be completed in a sequence, with each stage being more or less completed before the next stage can begin. These are sequential activities. The main difference between a Gantt chart and critical path analysis is that a Gantt chart offers a timeline view of the project, whereas critical path maps the sequence of scheduled tasks that determines the project's duration. This shows Gantt chart that on horizontal axis, months are given, and on vertical axis, activities that are performed are given, like train midwives, supervise midwives, etc. This shows the picture of critical path analysis that we start sequentially and finish the task. 11th point is planning for monitoring and evaluation. Monitoring and evaluation is the quality control mechanism and forms part of management and organization responsibilities. It is important for the success of health interventions. The purpose of monitoring and evaluation is to render healthcare as efficient and as effective as it is possible. Determine whether objectives and expected results are being reached. Verify whether plans are being implemented in the way and manner they were planned to be implemented. And it ensures that all components of the health service delivery system are in place and functional. Factors affecting the planning cycle. 4 main factors are identified. These are contextual factors, content factors, operational factors, and structural factors. Contextual factors these are in order of fact. The first factor that affects the most includes poor communication, disharmony, environmental uncertainty, and lack of clear leadership and guidance. Content factor. Content factors include non-accepting organizational activities, cultural or divergent organizational culture, an unclear and ambiguous strategy, that is strategy not patient-centered, and resource limitations. Operational factors include ineffective operational arrangements and lack of commitment of decision maker. The last one is the structural factors. These affect the least, that is lack of inspirational leadership, poor financial control and planning optimization, poor project management skills. Now coming towards the recent advances, this is the article that shows health planning in Pakistan. It's a case study. It shows that there has been a lack of functional clarity. in the planning cycles. The respective roles for bureaucrats and politicians have been unclear, and links between capital and recurrent budgets and between planning and implementation have been weak. As a result, there is a number of imbalances in the allocation of resources. Another recent advance that shows priority setting in the Provincial Health Service Authority. That is also a case study for 2005-6 planning cycle. The key points to take things one step at a time in these are priority setting as a management process needs to adapt to context, and a change can thus be slow. The process described here is clearly more transparent and more evidence-based than activity carried out previously in the Provincial Health Services Authority. In time, with proper evaluation, the PHSA can continue to improve its priority settings, thereby making strides towards getting the most out of the limited resources available. MCQs. MCQ number 1 is to maintain a health system. Different NGOs are working worldwide. Amongst which of the following seek to bridge the gap between where the team is at present and where will it reach? Option A is organizing, B planning, C criticizing, and D directing.
B planning.
Yes, B is the right answer. This is planning. MCQ number 2 is which of the following has been the objective to ensure that planning process can be carried out smoothly in a planning cycle? First is plan the planning, B is situational analysis, C is review of available resources, and D development of interventions.
A, plan the planning.
Yes, A is the right answer. Plan the planning has the objective to ensure that planning procedure can be carried out smoothly. MCQ number 3 is situational analysis interprets all information available from the various sources. Which of its type helps to determine the magnitude of problem? Qualitative type, B is quantitative, C analytic, and D descriptive.
D, descriptive.
Yes, D is the right answer. Descriptive type. A Gantt chart is a type of bar chart that illustrates a project schedule. On its vertical axis, it represents time interval, tasks performed, name of organization, and C is undone tasks.
B?
Yes, B is the right answer. Tasks performed are on vertical axis, while time interval is on horizontal axis. MCQ 5 is a couple is trying different types of contraception procedures regarding planning cycle to determine the usage of contraception comes under which category of situational analysis? Analytic, descriptive, data gathering, or Porter 5 analysis?
A. B.
Option B is the right answer. Descriptive type. During the health cycle planning, it was decided to have 350 training sessions for midwives in a district in 6 months. This comes under the umbrella of A, objective, B, goal, option C is target, and D, aim.
Target?
C.
Yes, C is the right answer. COVID-19 is a worldwide pandemic. During the COVID vaccination, the planning team needs to review availability of vaccinators and supervisors, adequacy of vaccine. Making sure of the supplies is dealt by. Option A is the Developmental Intervention Board, B is Review Policy Board, C Management and Organization Board, and D Finance and Budget.
C.
C. C.
C is the right answer. This is the responsibility of Management and Organization Board. MCQ number 8 is, in a developing country, state decides to train 400 staff and 250 doctors. The purpose is to prevent the country from anemia and malnourishment in coming 5 years. This is option A is target setting, B is objective, option C is goal, and D is aim.
Goal C.
This is
A.
B is the right answer. This is objective. MCQ number 9 is, in planning monitoring, both Gantt chart and critical path analysis are important. The main difference between them is, option A is Gantt chart offers a timeline view of a project, whereas a critical path maps the sequence of scheduled tasks that determines the project's duration. Option B is Gantt chart offers a sequence of schedules, whereas a critical path maps the task that determines a project's duration. C, they're both the same. And D, in Gantt chart, time is on x-axis and vice versa on critical path analysis.
A.
A.
Option A is the right one. MCQ 10th is, in the implementation of planning cycle, team members are not very much familiar with the language of the area, but they still somehow manage to proceed. The factors affecting the efficacy of the cycle during planning, in this case, may be organizational factor, B is content factor, C is structural, and D is contextual factor.
D.
Yes, D is right answer, contextual factor, because they cannot understand the language in that area. This is the key. These are my references, and thank you.
Thank you very much, Dr. Isma. Overall,